Hi, I'm Dr. David Hill, and today we're going to be talking about how to cure a baby's acid reflux. Now, acid reflux is very common in newborns and infants. In fact, it's so common that you could almost consider it normal. So, if it's normal, why would we want to treat it? Well, it depends on how bad it is. When acid reflux gets bad, we call it gastroesophageal reflux disease. How do you know it's bad? Well, the baby may spit up excessively. A little bit of spit up is very common in infancy. However, if the baby is spitting up really large volumes with every feed, that may be a problem. Your baby may be unusually fussy, and if that fussiness is related to feeds, you want to look at that as a possibility for acid reflux. Likewise, if your infant seems unusually congested or is coughing or wheezing to an unusual extent, you usually think, oh gosh, they caught something, but sometimes that's the only sign that you get of acid reflux. The stomach acid and contents may just get right to here. They may never spit up. So you want to be thinking about gastric reflux or gastroesophageal reflux disease in any baby who's developing chronic stuffiness, congestion, wheeze, cough, weight loss, fussiness, or just things aren't going very well with feeding. So if we've diagnosed it, then what do we want to do about it? Well, probably the single most effective thing to do actually has to do with feeds. Now, if you're nursing your baby, you're doing the best you possibly can. There's nothing to change. If, however, you're formula feeding your baby, you can take a teaspoon of rice cereal, a level teaspoon, for every ounce of formula that you make and thicken the formula. When you do that, you may need a larger opening in the nipple for the baby to actually be able to eat the formula that comes out. What happens here? Is it because the formula is just thicker? Is it a physical phenomenon? No. What we're shooting for is to get more calories in every ounce of formula so that your baby can eat a little less with each feed. The idea is to have the baby eat perhaps 1 ounce less than he or she was eating before, but keep the rate of feeds about the same. Now, we're not trying to starve your baby. We want to make sure the number of calories going in is the same. So you may need to feed a little bit more frequently as well. Still look for those hunger cues from your baby. If he or she is, gnawing at their hands and looking around for some food, for gosh sake, don't starve them just because you're treating reflux. But reducing the size of the feed and increasing the frequency may be one way to take care of that. Now, there are some commercial preparations now of formulas that already have rice thickeners in them, so that's another option for you, but you can do this at home for a lot less money and be equally effective. Now, your doctor has a couple of medical therapies that he or she may want to try. They're both aimed at reducing the levels of stomach acid. We think that acid in the stomach may make gastroesophageal reflux worse or may make the symptoms of the disease worse. One type of antacid that we use is ranitidine. Some people use a similar medicine called Axid. These medicines reduce stomach acid secretion in the stomach reasonably well. We've used them for years and years in babies, and they seem perfectly safe and reasonably effective. When those don't work, we either switch to or add a type of medicine called a proton pump inhibitor. This is a more powerful type of acid suppression. Now, because they work in two different ways, sometimes you want to use them both together. So don't be surprised in a bad case if your doctor says, keep the ranitidine, but let's add Prevacid or Prilosec, those are omeprazole, thinking esomeprazole, the Prevacid is lansoprazole. So those two medicines can be used interchangeably in addition to the other acid suppressors. Now, you can try tilting the head of the baby's crib up. You want to try and keep him or her somewhat upright but not slouched over for about 30 minutes after a feed. So positioning may help. You could put your baby across your lap, tummy down, face down, but you don't want your baby to ever sleep face down because that increases the risk for sudden infant death syndrome. Also try burping frequently during feeds. That may help a little bit as well. Gastroesophageal reflux disease is very common, very pesky, but it almost always gets itself better. So sometimes doing your best with the help of your baby's healthcare provider, as well as just waiting for the thing to get better, is the best thing to do. Talking about treating gastroesophageal reflux disease in your infant, I'm Dr. David Hill.